The keto diet is immensely popular today, but many people complain that they have difficulty achieving ketosis as reflected by the urine test for ketones. So, what do they do in a situation like this? Let us examine this question. The ketogenic diet has been around since the 1920s when it was introduced to treat intractable seizures. Today, the ketogenic diet is a popular diet that is used for weight loss. The term ketosis refers to the build-up of ketone bodies such as acetoacetate, beta-hydroxybutyrate, and acetone in the blood when the body enters a state of low carbohydrates. This most frequently occurs when people are fasting or when they are involved in extensive periods of intense exercise or in people who are following a ketogenic diet. Sugars or carbohydrates are the preferred source of energy for our body. When carbohydrates are lacking, the body turns to fats. Fats in the diet and fats stored in the body are mobilized, and they travel to the liver where they are broken down into ketone bodies. The ketone bodies then travel in the circulation to other tissues in the body where they act as an alternative source of energy. This is especially important for our brains. Our brains are unable to use fats directly as a source of energy, as opposed to, say, the heart muscle or the skeletal muscle or the kidneys. It is believed that the weight loss caused in keto diets is the result of appetite suppression by the high level of ketone bodies in the blood. The formation of ketone bodies is a natural process in the body, and healthy people following a regular diet also have ketones in their blood during periods of fasting, in between meals, or when they exercise for extended periods of time. The mild ketosis that arises in these situations is not harmful. People who follow ketosis diets monitor their progress by checking their urine for ketones. The appearance of ketones in the urine usually appears after about 2 to 4 days of following a diet with less than 50 grams of carbohydrates. But some people can fast for weeks and still not detect ketones in their urine, and this distresses them. There are several reasons ketones can be absent from the urine in someone following a keto diet. One of these is that the ratio of fats to carbohydrates in the diet may not be adequate. In order for the body to enter a state of ketosis, it is necessary for there to be about 80% fat in the diet, and that the carbohydrates in the diet be minimized and kept to below 10% of the diet. These people may be consuming carbohydrates unawares. They may not be aware that there are hidden carbohydrates in some of the foods they're consuming. For example, there may be carbohydrates in the yogurt that they're consuming, or there may be carbohydrates in tomato sauces that they use, or in barbecue sauces that they use. Too much protein in a diet may also be a source of sugars through a process known as gluconeogenesis, in which protein in the body is broken down into sugars. In such situations, it may become necessary for people on the keto diet to either increase the ratio of fats included in the diet, decrease the carbohydrate content even further, or decrease the amount of proteins that they're eating. And if these measures do not work, then they may need to increase their activity level, because the body goes into ketosis, or ketone bodies are produced during extended periods of exercise when the muscles and the liver run out of sugar stored as glycogen. Another reason for difficulty achieving ketosis may be the test itself. The urine test for ketones is the cheapest and most popular, but these tests are inaccurate, frequently producing false positive and false negative results. Urine test strips or urine tablets for testing for ketones that are left open to the air can be damaged and then produce false results. The urine test only measures acetoacetate or acetone in some cases, both of which rise to a lower level than beta-hydroxybutyrate in the blood, the gold standard. And beta-hydroxybutyrate is only measured by the fingerstick blood test that is commercially available. The problem with this test is that it is more expensive. The breathalyzer test, the test for ketones, acetone specifically, is also more accurate, but like the fingerstick blood test, it is more expensive. People who follow the keto diet should know some things. Number one, they should know that the keto diet is highly atherogenic, and it predisposes them to several diseases such as heart attacks and strokes and kidney disease. Low-carb, high-fat diets lack minerals and vitamins and phytochemicals and electrolytes, and have been associated with cancers and thinning of the bones and birth defects. That the keto diet has not been shown to be more effective in the long run when compared to other calorie-restricted diets means that this diet should only be followed in most cases for a short period of time. Thank you again for watching. Leave your comments in the section below. Hit the like button and subscribe to the channel to support us and help us to grow. Until the next video, stay healthy and stay safe.